very warm welcome to fresh episode of DD Dialogue, and this one indeed is special because this is dedicated to the overall COVID response mechanism spearheaded by India. Why we are talking about it, viewers, because remember, domestically speaking, it's been almost a year and globally more than a year since COVID-19 pandemic struck the world. And Is India actually leading the way? Why we are saying this? Because remember, India started with one COVID testing laboratory. From one COVID testing laboratory to firming up the infrastructure, lab infrastructure and medical infrastructure to actually spearhead vaccine matrix operation, which is now becoming an international talking point, diplomatically and otherwise also. And the fact that India happens to be the first, one of the few countries also to have launched world's largest vaccination drive. But when we talk about all this, when we talk about this trajectory, there are lots of challenges, but there were also collaborations and convergences as well. What made this really possible and what all is needed? Is India leading the way, and how? And what are the future templates? And are we inching closer when we talk about COVID-free world? Will India be ahead of the curve then as well? We're going to talk about it, and very honored to introduce our distinguished panel of DD Dialogue. Today we're very glad to have Sri Rajesh Bhushanji joining us on the show. Secretary Health, Government of India, he's joining us on the show today. Thank you very much, sir. Thank you very much, sir, for joining us and taking out time. We're also joined by Eric Fault, Director and Representative, Unesco, New Delhi Cluster. Eric, namaste. Thank you. Extremely glad to have on the show Nishta Satyam, Deputy Country Representative, United Nations Women, including India, Maldives, Sri Lanka, as well as other nations as well. And very glad, as always, to have Dr. Yasmin Ali Haq in our Delhi studio, of course, UNICEF India representative. Thank you, ma'am. Thank you so much. And before we start the discussion, let's take a look at the massive work put in place by Ministry of Health here in India in terms of not only containing the COVID-19 pandemic, but also eliminating the cases. India's COVID response combat strategy success story can be equated with magic. With the robust interventions and policy decisions spearheaded and implemented by the Ministry of Health and other ministries of the Government of India, it became possible to contain the spread of the deadly virus. The country first reported COVID-19 case in the early months of 2020. The initial days saw a surge in positive cases, but the Ministry of Health swept into action and worked on war footing to contain the spread of the deadly virus and keep it under control. People were asked to wear masks and step out only if absolutely necessary. India recorded 97,859 COVID-19 cases, the highest in a single day number on 16th of September 2020. And since then, there was a remarkable decline in positive cases despite regular rigorous testing being carried out across the country. The swift action by the Ministry of Health made India battle the pandemic well, and figures are proof that India has been a success story. In the beginning of the second week of February, the total number of active cases stood at 1,48,609. The ICMR-backed testing strategy said on 16th February that the total number of COVID tests conducted was 6,97,114. The number of tests returning positive for COVID-19 was 11,106. India started the world's largest vaccination drive then. India's drug regulator has approved 2 COVID-19 vaccines, Oxford AstraZeneca's Covishield and Covaxin of Bharat Biotech. The country is also working on at least 7 other COVID-19 vaccines in pipeline. Here's a quick look on India's vaccination drive, the largest in the world. COVID-19 vaccination drive in India began on 16th of January 2021. The Made in India COVID-19 vaccine is as effective as any vaccine developed by other countries. In the first phase of vaccination drive, healthcare workers, sanitation workers and other frontline workers, defense forces, police and other paramilitary forces were being inoculated. The second phase began on 1st of March, in which people over 60 years as of 1st of January 2022 and those between 45 and 59 years of age with comorbid conditions are inoculated. Indians can get the jabs at government as well as private clinics. The vaccine is provided at free of cost in government hospitals, while the price of per dose of COVID vaccine in private hospital has been capped at Rs 250. The nation has shown the great urgency to complete the elimination of COVID cases to ensure that there is no surge, and this could not have been possible without the robust implementation of the policies by the Ministry of Health and Family Welfare. Bottom line being, India met pandemic challenge and leveraged its strengths to mitigate the impact of pandemic to great extent. Undoubtedly, tough measures taken by the government have placed India in a regime of one of those rare countries which is constantly witnessing decline in cases and massive outbreak control. I'm going to quickly throw the floor open to Honorable Secretary Sir, who is with us on the show. Honorable Secretary Bhushanji, if you could just share a little bit more on the new variant that is being really talked about these days. Why I'm asking you this, because we will not really first go back and assess how we have done, but let's talk about what's happening currently as we speak. Our Swadeshi vaccines have seen humongous success, but then at the same time, we're also looking at new variant. How is government poised to do with this challenge, and what latest can you share with our viewers?
What is happening presently? So the most important thing happening presently is the COVID-19 vaccination drive in India, which is the world's largest vaccination drive. Presently, we have inoculated or vaccinated about, as we speak, about 2 crore people, which is 200 million people. So that's a huge number. Why has this been made possible? This has been made possible largely because of two developments. One, that we have a very robust and very effective domestic manufacturing capacity for vaccines, and we have two vaccines that are being manufactured in the country. Two, we also have a vast network of public health facilities. These are facilities that are owned by either the union government or state government, which can work as vaccination centers. And we have an equally vast network of private facilities, which have also been co-opted and are working hand in hand with the government as vaccination centers. This whole exercise has been strengthened by a very focused and targeted communication activity, which addresses vaccine hesitancy, which addresses the issue of vaccine safety, vaccine immunogenicity, and vaccine efficacy. So I think taken together, this is enabling us to ensure a nationwide rollout without too many glitches. So that's one activity that is happening. The other activity that is happening is the public health response to COVID-19 over and above the vaccine. And what are those elements of public health response? Those are testing people, tracking the close contacts of people who test positive, quarantining them, isolating them in time, and ensuring that standard treatment protocols are followed.
Absolutely.
So what is the result of all this? The result of all this is that our per million positive numbers are very, very manageable, and they compare very favorably with other countries that have huge population. Our COVID mortality is among the lowest in the world.
Yes.
And we have been able to manage COVID so far effectively without our healthcare infrastructure creaking or cracking under the strain.
Yes. Yes, right. Eric, let me quickly come to you now. Talking about UNESCO, very quickly, education has been one of the, factors which has been really affected a lot. Education, and UNESCO herein has actually pitched in, whether you talk about the online courses and specifically that program that I was reading about, aiding craftsmen for skill development and designers. First of all, my question is very quickly a bit more about that, and what is UNESCO's assessment, the way things have been actually implemented on ground?
I can underline that globally more than 1.5 billion students and youth have been affected by school and university closures due to the COVID-19 pandemic. And it has been our biggest concern, and we have worked very closely along with other UN actors, and I'm very glad that you have my colleague and friend Yasmin Haq from UNICEF with you, because since the onset of the crisis, indeed more than a year ago, UNESCO has been advocating for, in particular, I would say first and foremost, safeguarding the access to quality and equitable learning opportunities for all. And we have tried to focus, again, globally, on providing support to the most vulnerable and disadvantaged communities. Our response really has been at the global, at the regional and national levels, mainly on advocacies and partnerships with the ministries of education, and that's certainly what we have done here in India. The key concern was to ensure continued learning for all children through any alternative channels, and in particular digital learning resources and knowledge dissemination. And I think that's where India has really made a big difference during this crisis. I think digital learning has made giant leap forwards, and perhaps in India more than anywhere else.
Yes, digital revolution. And let me get a quick one from Dr. Yasmin, UNICEF. Children also need to be vaccinated. Education was badly impacted. UNICEF did its bit. But starting with the vaccine, as Honorable Secretary also put forth, the robust mechanism that is put in place. But the question is, rather the challenge is, equitable access to this vaccine by one and all.
Thank you, and really just to echo the words that in India we're seeing one of the world's largest vaccination programs, and the fact that we have reached 20 million mark. I think in 24 hours we saw more than 1.5 million of the most vulnerable being vaccinated, and it's built on the infrastructure, on the expertise and the experience that India has when it comes to running vaccination programs.
Okay.
Now, when it comes to children's programs, I think one of the crucial parts of rolling out the vaccine was to who do we target first? And that's where the health workers, the frontline workers, they are the ones who got the vaccination first. And as they get their vaccines, as they get protected, as the confidence of the community increases, that when they take their children to a vaccination site, they're not as much as risk of getting COVID. That's where we've seen over the past months, the vaccination rates have started increasing. So it's really important that we see the vaccination in a broader manner, that it's not just protecting the individuals who get the vaccine, but it's also creating an enabling environment for children to start getting the vaccinations that they hadn't done. And the catch-up is happening pretty rapidly.
Okay.
So, but the equity issue that you raised, I think that's very important. Equity, of course, within the country there is equity, but there's global equity. India is definitely pitching into that. And the fact is that we are in a situation where partnerships have had to come together.
Yes.
Partners like Gavi, CEPI, WHO, UNICEF have come together to, along with member states, of which India is also a member, to come up with the COVAX facility, which is looking at finding mechanisms so that even the poorest countries who would not probably be able to purchase the vaccine on the open market are able to get it at an affordable cost.
That's where our neighborhood first policy comes into picture, and that's the whole ambit of vaccinatory operation. Nishta, coming to you very quickly, women. Workforce, women at rural level, panchayat, Anganwadi, Asha, the way this year has been for India and the commendable contribution, but that was not easy. That was not easy. Now when you look back, Nishta, Satyam, how do you assess, and especially now, from now onwards, now that the vaccination is underway and the kind of response it has generated, what is the kind of template, if I talk about your agency, UN Women, that is in place to ensure the equitable access and empowering women?
Thank you. Start with commending the Government of India for the scale of the intervention, for the efficiency of the intervention. Personally, I had my parents vaccinated today who are both above 65, and I was very, very surprised and very, very pleased with how easy the process was. One could see that.
I think you should compliment Secretary Health.
Absolutely, I'd like to compliment and commend the work that the Government of India has done, particularly the Ministry of Health and Family Welfare. And I was very pleased myself as a national, as an Indian, how smooth the process was. It was visible that hospital staff were getting first priority, even if there was a line.
Okay.
And let's be honest, about 70% of any country's global healthcare workforce is women, and we mimic that statistic too. So by coincidence, we do have women on the front lines who have been prioritized, and I think that's a great way to start. But let's also look at what the year has done for women. It has exposed and widened the gaps that we started out with. Women started the year with poorer health outcomes, with lesser access to assets, lesser access to the digital world, lesser access to the workforce. And there are lessons that we have from situations like Ebola, where, pretty much if you were to analyze Ebola and apply it to a situation like this, we know that there is a risk of almost only 50% of women making it back to where they were before the pandemic.
Okay.
And any pandemic or any situation like this does distress women in fundamentally different ways. And I think our response mechanisms have to pick that nuance, have to address it. And that is going to be at the center of the equity that we spoke for. That is going to be at the center of equality that we're looking at in at least the goals that we have agreed to in 2030. And I think we have an opportunity as a country to also establish ourselves as the lighthouse of the global south, in terms of not just vaccination, but also working on a mission, more delivering. At the same time, we have a responsibility of building back better and building back equal. And I think that's a great balance to have. That's also there are twin burdens, but I'm fairly sure that we will get there.
We'll talk about the twin burdens also, because there are lots of challenges. But Rajesh sir, I'm coming to you again. There is no shortage of vaccines. Government of India has made it absolutely clear. Government of India is implementing the PPP model, which is actually cutting a lot of ice with the people. What would you say? There's a lot of buzz about few more Make in India vaccines in pipeline, and ensuring that states are well equipped with supplies, but yet at the same time there should not be any hoarding up of that.
You see, before we talk of the Made in India vaccines which are in the pipeline, it is important to see the numbers in perspective.
Okay.
So we started this largest vaccination drive in the world on 16th of January, which was focused on healthcare workers. Then on 2nd of February, we started frontline workers. And on 1st of March, we started people who are 60 years and above, and we also started people who are 45 years to 59 years suffering with comorbidities. Certain comorbidities were specified in advance. So this big cohort has been now under vaccination for roughly 50 days. So India's vaccination drive is only 50 days old. We must also keep in mind the fact that certain countries like UK, USA and other European nations started in December itself. Some of them on 8th December. So they started almost 30-40 days prior to India's launch of the vaccination drive. So in the 50 days, using 2 India manufactured vaccines, we've been able to vaccinate, as I told you, 20 million people, which is 2 crore people. And going ahead, the drive will pick up steam.
Okay, okay.
When I say that the drive will pick up steam, it means that our vaccine bouquet will not be limited to the present 2 vaccines that we are using, because there are presently at least 4 or 5 other vaccines which are in their phase 3 or clubbed phase 2, phase 3 clinical trials.
Okay.
And very shortly they will be approaching the national regulator for emergency use authorization.
Okay.
And then the bouquet would expand. The bouquet of vaccines would expand. from 2 to probably, 4 or 5. And going ahead, there are other vaccines in the pipeline who are
Yes.
doing their phase 1 clinical trials, because we've been actively disseminating this information. So the last point I was trying to underline is that when you look at COVID-19 vaccination, it is unlike the vaccines that we use in India's universal immunization program for vaccine preventable diseases. So there, since the vaccines have been in use for decades, we can go at sub-health facility level. We can even go to sites which are, panchayat bhavans or community centers or someone's, some public facility, but not a health facility. But these vaccines across the globe, including the 2 that we are using in India,
Okay.
are under emergency use authorization.
Okay.
People have to take the vaccine and then be observed for at least half an hour. So, and these are adult vaccines. These are not vaccines to be administered to children or pregnant mothers as
Okay.
we do in the
Okay.
universal immunization program.
Okay.
So therefore, the pace of vaccination cannot be and should not be compared with the universal immunization program that we run in India. The
Okay.
fact remains that the infrastructure, the knowledge, the paramedical staff, the training, the experience that we have of universal immunization program is used
Yes.
in the present vaccination drive also. But 2 are not comparable. They are not comparable at all.
Yes.
They are 2 different and distinct kind of vaccinations. So therefore, it can be understood why among large sections of society there are issues of vaccine hesitancy which needs to be addressed in a proactive manner, and we are doing it.
Okay. Very quickly, Dr. Yasmin, we are slowly and gradually moving from that vaccine hesitancy syndrome to vaccine eagerness syndrome. I want UNICEF's assessment to it, because this is one domain your vertical is actively working on. We started with some apprehensions. There were a lot of fake news information on so-called side effects, etc. Now we are in the middle of the second phase, and I'm sure you heard Honorable Secretary also talking about there is so much in offing.
Absolutely, and I think one of the great things of working with Secretary Bhushan is that his attention to behavior insights, and we've worked very closely with him to provide him with the information that we're getting through community-based monitoring and through other formative research to look at what is going to be the motivator for vaccination, because he, as he said, this is adult vaccination. It's not you just pick up a child and go and get it vaccinated. It's adults having to make a choice that they themselves might suffer side effects, might look at issues that come up from it. So that fear part of it was there in the beginning. And that's where the behavior insights told us that most people, about 78 to 80% people, knew about the vaccine.
Okay.
Of them, whether they were willing to take vaccine or not, we found that it's really those who are the poorest and the least educated were somehow more hesitant, either because they had not heard about properly, or they had were worried that if they have to travel to go and get the vaccination, there's cost associated with it. Some people don't believe in scientific medicine. They prefer to go for more traditional ways. Methods, so a lot of that hesitancy was there. So the campaign that is there to really, the behavior change and risk communication work that's taking place is trying to address these issues. And when we see more people getting vaccinated, when we saw Prime Minister Modi getting the vaccination, that's the role modeling that is happening. And we see every day in states, well-known figures are getting vaccinated and being very public about it. And that definitely adds to people's confidence. The other thing we found is that people actually trusted health facilities, government health facilities, more than private health facilities, because they believe in, they have confidence in the government, they have confidence in the scientific work that the government has been doing. And they have confidence that the government, when it's approved something, it will not be harmful to them. So building on these confidence, it's been really important that we're able to showcase the stories, to address the negative messaging that is also out there. I think WhatsApp groups are out there at times. In some other media, we also see hesitancy issues or anti-vaccination movements. But we've learned from our experience, and Sri Rajesh Bhushan knows of the MR campaign, the measles rubella campaign, under which 324 million children under the age of 15 are vaccinated. And we learned from the vaccine hesitancy we faced during that in the first round, and applied that to how we can really preempt what's happening with COVID vaccination. And in fact, in the ministry, there's a very strong cell who are constantly monitoring all forms of media to look at where the hesitancy and what needs to be addressed.
Let me get a quick reaction from Mr. Bhushan before I go to Eric and Nishta. Mr. Bhushan, that was also one of the aspects that was dealt very firmly with the government, by the government of India, dealing with the misinformation campaign. Do you think we have crossed that, that hurdle now? And what are the benefits of vaccine, the whole process that one has to go through? Everything that comes with the vaccination is now out there in public domain, and you see a lot of public trust and confidence. Not that it wasn't there before, but this has multiplied. The whole thing has escalated. Mr. Bhushan.
Well, it's a dynamic situation. It keeps on changing, so you need to monitor it in a dynamic fashion. But I would tend to believe that issues related to vaccine safety, immunogenicity, and efficacy have largely been addressed.
Okay.
Issues that now engage the popular attention as well as government's attention is access to vaccination, a citizen's ability to know the nearest vaccination centers, a citizen's ability to then go to those centers and access vaccination by first either registering in advance or registering on site. We also have something known as facilitated cohort registration, which is meant for groups. They could be resident welfare societies in urban areas. They could be old age people in rural areas being facilitated by our accredited rural health workers, the ASHAs. So that is what now engages the attention of both government as well as the common citizenry.
You talked about rural sector, but very important. Let me quickly get Eric here. Eric, UNESCO has been doing a lot in that space. Basically, when we talk about the training modules that have been floated by UNESCO, especially for artists in India during pandemic.
Yes, absolutely. But perhaps before I talk about culture, I really want to go back to this issue of misinformation and disinformation related to COVID-19, because it's also one of the areas directly of relevance to UNESCO's mandate. And here I want to say that COVID-19 has clearly exacerbated misinformation and disinformation. It has magnified its negative effects on public health efforts to counter the pandemic. And it was more pronounced among rural and also, I would say, migrant communities. That is why we have worked in particular through our network of community radio stations. We have a network around the country, and we've tried to work with them to counter the spread of COVID-19 misinformation through awareness raising, solidarity with community groups, and much more. I think very often we have found that there was a lack of content on COVID-19, so that's an area that we have worked with community radios on. And when it comes to culture, here obviously it's very important to discuss it, because even though they are not, I would say, officially acknowledged as vulnerable groups, artists, and within the broadest sense of the word artists, have been part of the most vulnerable groups. They're some of the most precarious they have some of the most precarious status and working conditions. COVID-19 aggravated their very fragile status. That is why, again, worldwide, we launched a global movement called Resiliart to support artists, and why we also replicated this movement in South Asia. The idea was that by raising awareness and advocating effectively to improve the status of artists, we would also help them, because they were one of the forgotten groups.
Yes, one of the forgotten groups, and UNESCO is doing their bit to ensure that they are not ignored anymore. And Nishta, I can see you smiling out there. So even UN Women, I mean, came with a lot of to-do list and huge set of responsibilities, especially the work that UN Women has done in the rural clusters. How much of the path has been covered so far, and especially the challenges bit?
I think it would be preempting, and I think it would be premature to say that, you know, so much of the challenge has been covered, because we've just begun addressing the problem. We have just gotten to vaccination. I think we're yet to look back at the damage that COVID has done to, you know, to the workforce, to jobs, to the economy. Women. But what I definitely know for certain is that we cannot have a progressive conversation without center staging women and children in this conversation.
And how was this integrated, like the exercises that your vertical carried out, and what is in place for future now?
I think our role was to assist the government in whatever ways that we could, and I think we've been bringing in the gender conversation, because it's important for us to realize that women didn't particularly have the same starting point, and they don't. So they start from far behind. So it's important really in events like these, in situations and circumstances like these, that we prioritize women. Now, for example, let's take public health. There is always a tendency in the Indian household for the woman to go last. Whether that be nutrition, whether that be access to health, whether that be access to vaccination, almost that, you know, she's never thought of as a priority candidate. At the same time, women influence about 90% of these decisions in the household. So irrespective of what perspective you take and where you look at it, women are a very, very important constituency to bring change. Women are going to be a very important constituency to ensure that we deliver on this mission effectively, and they're going to be probably one of the most important constituencies to build back better. Purely because of how they've been affected, but also the fact that, you know, we have to be able to leverage this little new awareness on health, on public health outcomes, ensure that this translates into nutrition, ensures that it connects with other aspects like violence that have actually, you know, that has been a shadow pandemic for the country, actually for the globe across. So it would be premature definitely to say what has already been covered. I think much has been covered, much is yet to be covered. But we cannot have these conversations without center staging and bringing women right at the center.
It's very interesting. In fact, since we have Bhushanji with us, in fact, you can also make a quick point and pitch in. You know, UN Women, they have, sir, a list. I wouldn't say a long list, but what really is desirable, what really is expected from the government of India when we talk about how UN Women, this arm of United Nations, has been pitching in terms of COVID response? Would you like to talk to him?
Sure, I'd like to commend the Secretary for the wonderful work, and I'm saying this out of great pleasure today because I did get my parents vaccinated and I saw the process myself. So I'm coming from that very positive viewpoint. But also, honestly, as an intergovernmental body, we don't particularly have an ask or a set of things to ask from the government, but we do have all our expertise to offer. I think, like Yasmin said, collaborations have made this possible. So in all humility, we have expertise, we have rigorous gender knowledge, we have rigorous insights based on how women would act differently in a certain situation, or would consume information differently, or would pass on information differently. And let's not forget that women are agents of change on the ground. They are carriers of culture, they are carriers of practices within the household, and therefore a very, very important target constituency. So I'm only here to offer my expertise
If I could,
and my partnership, and I think that's what everybody would say.
Yes, if I could just come in,
sure,
and Nisha, you'll be happy to know, when I last met with Secretary Bhushan and we were talking about, are we monitoring whether men and women, how equitably the vaccination is taking place, he just got me to open up CoWIN, and it shows the sex disaggregated data, and I think that's one of the biggest things.
Absolutely.
Looking at data, so the sex disaggregated data of vaccination, are women going back to the facilities for deliveries? Because I think India reaching where.
So what was the data? If you could just share a bit more about
Well, that was in the beginning. It was when the frontline workers were being vaccinated, health workers were being vaccinated, and at that time it showed more than 50%. Was women.
Okay.
Because the target group is also
women. But you know, Sakal, I think the larger point that we're trying to make here is just collecting sex disaggregated data is a great starting point to be building back better and equal, because that will then form the basis of behavioral insights, of the opportunities to build back better.
Let's take this point to Honorable Secretary. Mr. Bhushan, your thoughts? Here we have UNICEF and UN Women commending Government of India for the way this has been covered, the gender parity in vaccination, if I may put it this way.
It's being monitored.
The
numbers are being...
The numbers are being monitored, and as of now, the numbers look good, Mr. Bhushan.
Let me respond by making two generic points and two specific points.
Sure.
The generic points are the need for collaboration. Within government also, we are advocating a whole of government approach, which means that Ministry of Health collaborates with Ministry of Women and Child Development, and together we collaborate with other ministries by fine-tuning our COVID response. So that's generic point number one.
Sure.
So the same collaboration extends to UN agencies, whether it is Unesco, UNICEF, or UN Women, or other agencies. Then the second generic point is that if you are collecting data, that data must be put in public domain with certain filters, obviously, to protect privacy and to ensure security. But your decisions must also be driven by that data. So that we have done in CoWIN, and we have linked CoWIN, which is our digital platform tracking the entire vaccination process. We have linked it to Arogya Setu, and what I showed to Ms. Yasmin Ali was, in fact, the Arogya Setu route from where any citizen of the country can see the total number of vaccinations done in a day, the gender-wise disaggregation, the public and private facility-wise disaggregation, so on and so forth. Now, specific points.
Yes.
The first specific point is that there can be no argument about the fact that women did bear a disproportionately higher burden of this pandemic in the last 1 year.
Okay.
Second generic point is that women were also at the forefront of fighting this pandemic, at least in India.
Absolutely.
Yes, absolutely.
At 10 lakh ASHA workers, we had 3 lakh auxiliary nurse midwives. So this force of 13 lakh women in our rural and peri-urban areas were single-handedly responsible for surveillance, for containment, for house-to-house search of active cases, for creating awareness. So we must, at every possible opportunity, recognize this contribution and ensure that we further strengthen them, so that going ahead, they have this strength and ability to face to any unforeseen challenge.
Okay. Very, very valid points there, and very important, not only valid. Sir, your final word. What, through this medium of DD India, which is the external arm of the national broadcaster, Secretary Health, what is your message to not only the countrymen who are watching this show, because this is aired in Central Asia, Southeast Asia, in Americas and parts of Gulf countries. Overall messaging, sir, from the Government of India on India leading the way and the plan in future that is put in place.
Okay, so very quickly speaking, multiple answers to this question. One, a proactive and a preemptive approach delivers results. We don't have time, otherwise I would have elaborated how it delivered result in the country.
Okay.
Two, A whole of government and whole of society approach is needed if you are tackling a pandemic the size of COVID-19. Three, there is a need to invest in strengthening public health facilities and in strengthening surveillance facilities. Four, self-reliance is a must, what the Honorable Prime Minister calls Atmanirbharta.
Yes.
Self-reliance in drugs, in diagnostics, in vaccine, and this self-reliance leads to self-confidence. Self-confidence leads to a far more effective public health response. Investing in R&D and investing in human resource development.
Yes.
That is also a must.
Yes.
Because without investing in R&D and HR, it would be impossible to face to future pandemics. There is a need to focus on telemedicine and e-health services, particularly in our remote areas, where the access of patient or client to the health facility is obstructed by large distances, rivers, terrain that is not very hospitable. And lastly,
Yes.
Vasudhaiva Kutumbakam, the entire world is a family. That is where vaccine factory is situated.
Absolutely.
If we have vaccine manufacturing capacity, we must share it with the world.
Yes.
It is for our people, it is for other people, because until and unless you break and disrupt the chain of infection globally, no one is safe.
On that note, thank you very much, Rajesh Bhushanji, for joining us on this show. It's been an honor and pleasure at the same time for taking out time. Thank you so much, sir. Thank you so much. Thank you. Namaskar. Now let's talk about UNESCO, UNICEF and UN Women. UNESCO, that one aspect, Eric, what the criticality of water conservation and the way UNESCO dealt with this during these COVID times, especially dissemination of information at the rural level and the programs that were carried out by UNESCO during COVID times in this particular space. Eric.
Water is indeed an issue where a lot of UN agencies work together, and because water is a basic need for everyone, and in a COVID-19 scenario, it has definitely assumed a critical role, first and foremost, in ensuring that recommended hygiene protocols were being followed. So as far as UNESCO is concerned, and again, our role goes hand in hand with the other UN agencies, we have worked in particular to help children understand the importance of water. Recently, we launched a program called H2O, Water Wise Program for Children of India, which aims to encourage children to conserve water through very simple ways at home and in their communities. So we really provided a platform for also school students to submit stories on water conservation. Again, the aim is really to make the entire population, starting with the young ones, the importance of water. But this is, I must repeat, something that we work with several of our partners on, and we will have a chance very soon.
What has been UNESCO's assessment of the way, I mean, not really comparing it with the other developing countries, but assessment on overall COVID mechanism, the implementation of these policies on ground, basically the whole containment exercise of COVID-19 here in India, from UNESCO's perspective?
Lessons from COVID-19 will come much later from all of the UN agencies together. But perhaps at this stage I could cover one issue that I think is also very important, and again within the mandate of UNESCO, because it relates to the health and well-being of learners. And that's something that we have looked at very closely during the pandemic, and again worked very closely with the Ministry of Education. which is our main partner.
Yeah.
We all have different partners within the government and work, as my two UN colleagues have said, simply to advise and provide support as needed. But it has been challenging to maintain a healthy lifestyle in the middle of a crisis like COVID-19. And one of our concerns is to make sure that learners, that is children and students in schools and universities, can stay healthy, mentally healthy. So as part of the government's school health program, we've worked in particular there again to develop animation videos on health and well-being. They've been used by in 1.5 million schools across India, and I think they have successfully helped in regards to maintaining school health. This has really been one of our main concerns. We've launched also a publication recently called Minding Our Minds During COVID-19, again with the idea of helping school-going children to manage their mental health.
Fantastic. UNICEF?
So I think I'll just take off the point Eric raised, because the damage the pandemic has done by upending children's lives. Their movement is restricted, they can't go out and play, they've seen their parents facing hardship, the schools are not open, their socialization is not taking place. Girls are being expected to take on more chores within the household. And families have been affected, and it's really important that we not trivialize the damage it can do and has done to many families. Even our own colleagues, we've heard of their teenage daughters who are stressed by just looking at a screen all day because everything is on the screen. So it's really important that we help parents and caregivers, whether it's a grandparent or an elder sibling, to address these issues. And that's where the psychosocial support, the recognition that mental health is an issue and that we have the various toolkits, UN Women, UNICEF, UNDP.
So is UNICEF working on certain toolkits,
definitely,
programs?
And that's something that we estimate we've reached about 450,000 caregivers and children with psychosocial support activities. We are also really focusing on how do we safely see the schools reopening, Anganwadis reopening. Happily, we've seen 3 states where Anganwadi centers have started to reopen. So the 3 to 6-year-olds who had their daily routine are beginning to go back. In about 18 states and union territories, all the classes have reopened, and others are gradually beginning to do it. So as we see normalcy returning, whether it's in school or in the household, addressing the mental health issues are going to be important. Even asking about it makes a difference. And at the same time, I'll stress the COVID appropriate behavior. Because we've seen, if I look at the height of the pandemic, towards the end of last year, when we saw the behavior patterns of people were very well aware of the need to use masks, of social distancing, and now we've seen even the knowledge go down from about 75% to 60%. And then when we look, and so people are getting, you know, comfortable, a bit, complacent. And we have to address that, because even in the best situation we saw, while people knew, only 50% were actually practicing it. And that meant that those who are not practicing were, again, those who are more socioeconomically deprived, who can't afford not to go out or be in a workplace or to shy away from taking a public transport. So it's important that we keep this messaging going so that the pandemic's not over.
Yes. So basically the bottom line, Anishta, the pandemic is not over. The vaccination, the good news is that the vaccination is there. But a little bad news is that the pandemic is not over. That complacency you see seeping in, but COVID appropriate behavior. My question to you is, again, going back to your space, your domain, women, UN Women. What are the challenges that you really see now onwards? I mean, I wouldn't say what all has been done, but now it's not going to be that simple.
Absolutely, it's not going to be simple.
But when you compare, because you're dealing with multiple countries.
Well, on the onset, I think, it would be so wrong to compare India to any other country that we work in, or any other country in the world, because we're so unique, we're so deep rooted in our socio-cultural beliefs. We're so
Has
unique.
that been our strength?
Well, that could be a strength, depends upon how we leverage it. The culture of community wisdom is much older in India than it would be anywhere else. So I think we're too uniquely placed, both in terms of our diversity, both in terms of scale, to be comparing ourselves with anybody else. Is it going to be simple? Of course not. Do we see from the ground a sense of complacency, a sense of fatigue setting in? Absolutely.
Yes.
And we must recognize that COVID-19 is not just a fully fledged public health crisis, it is also a socio-economic crisis. It is also a crisis that has tripled the unpaid care work for women at home, with people coming back. It is also a time and space where women have experienced greater domestic violence, greater retaliation, greater fear, where women's entire liberty to walk out of spaces has been curtailed, mobility has been curtailed. So it is absolutely very, very different from how one person has experienced it versus another person.
Another person, correct.
The challenges from here on is to ensure but before I get to the challenges, it's important to understand what women experience. Women's lives, unfortunately, don't work in silos. It's not about a vaccine. It is not about access to nutrition. They have lives that intersect.
Yes.
They
yes,
have they go through a life cycle of discrimination. We are used to hearing this. It is discrimination from the womb to the tomb, right? And it's important to know that these life cycles intersect. So we know that a girl falling off school doesn't just mean a girl falling off school. In all probability, it would mean an early marriage. In all probability, it would mean an early pregnancy, an economic shock, worse off health outcomes for that woman. And in the end, just cumulative discrimination and a life cycle of poverty and alleviation. So, I think it's important to recognize how women's lives actually work. And once you recognize that, the challenges become very apparent. They become very obvious. Because if you lose girls and women to one part of this life cycle poverty, you risk losing them to a life cycle of discrimination. So
this has been a very important social impact or a fallout of COVID-19.
Absolutely. I think women's attachment with the labor force was already loose. With jobs coming back into the market, we have to ensure parity in reskilling. We have to ensure parity in access to jobs. We also have to ensure that women have access to nutrition. A lot of other issues with women's health has been ignored because COVID-19 has been at the center.
Yes.
So we are looking at the risk of reversing gains that we may have made as a country, which is why I spoke about the twin burden. So today, to me, the greatest challenge is the twin burden of protecting the past, preserving those gains, and crafting a new normal that this time is more equitable.
Yes, and that's exactly the new normal that we are talking about today. And I think I need to now wrap it up, but obviously, before we wrap up, we need to have final comments. UNESCO, we go to Eric. Eric, thank you so much for standing by and listening to the ladies talking so patiently. So my final question to you, Eric, would be what next? What next for UNESCO? And that question with which we started the show, India leading the way. Is India leading the way? Eric.
I think that in conclusion, I would like to perhaps talk about a group that is very important in the context of the crisis and that perhaps we have not spoken enough. And that's some of the most vulnerable in any society, including in India, and is person with disabilities. That's one of the areas that, again, with many of our UN partners, we have tried to support. UNESCO has worked in partnership with a number of stakeholders in the disability sector, and we launched a number of initiatives to try to support them. In particular, we set out to provide advice to parents and caregivers of children with disabilities. We issued a guidebook which proposes how to care for children with disabilities in times of COVID-19. COVID-19.
Okay.
As the
Fantastic.
COVID-19 pandemic unfolded, we've seen millions of people who found themselves in isolation, the most vulnerable, and indeed people with disabilities had it much harder than even anybody else, and that's how
Absolutely.
to conclude today.
Yes. Thank you very much, Eric, for those comments, and very thoughtful indeed. And Nishta, is India leading the way?
Well, it's a statement that one would want to believe. You know, the one thing that we know for sure is 1.3 million women at the front line serving the country, 1.3 million elected women representatives. Women-owned, women-managed businesses were the quickest to pivot in terms of business models, in terms of markets. So the story that we're seeing today of India producing masks and exporting masks is also a story that can largely be owed to how women have responded in the country. So we have an astounding story of resilience, of courage, and of determination. At the same time, this is not a success story that we could complete without hearing the voices of women, without ensuring that they remain center stage through it all. Most often we start well, we leave them out in the end, or we don't start well and you know we have a post facto approach to gender. This time we seem to have started well. Hopefully they will be at the center of our response so that we build back in a way that really looks at a more equitable future. And I think that women of this country have given us all reasons to be proud of how they can respond and hold back an entire country of more than 1 billion people and be responsible for it. And here we have in front of us, because of that, both an opportunity, which is also a possibility. So I think that's good news.
Yes, turning opportunities, first of all, turning challenges into opportunities, and then opportunities into possibilities, and that too coming from someone who is herself being one of the youngest women in the UN ladder, and that too being an Indian. I mean, that makes a lot of sense. But then, Dr. Yasmin, final word from you, ma'am. The whole idea of India leading the way, there were challenges, there's a lot to be done. One final comment, like she said, it's not possible without women as a workforce, but yet at the same time we have not reached that stage where women occupy that central focal point, you know. But then lot is being done, lot has to be done. When I ask you this, is India leading the way? What would be your answer to that question?
So I would say India definitely is leading the way in many fronts, and our aspiration is that India continue to lead the way, especially in reaching the most marginalized. Because if it's the person with a disability, it's likely the girl and the woman with disability who is more marginalized. And it's not just, you know, I think it's just adding to what Nishta said, the girl to woman continuum is not there's no clear outline in it. So let's, as we look at data, as we look at are we recovering, are we leading the way, always asking ourselves, are the most marginalized part of that journey? Are the girls part of the journey? Are the women part of the journey? And it's through getting that evidence, listening to them, what is keeping them back? And I think that is a possibility that we've seen through the response to the pandemic. When we took time to listen to people, to get their feedback, to act on it, to make sure that the information that they got was consistent, to build their confidence in the system, that's something we have to continue. So especially listening to the young people, the young women, and to children. They might not be as loud, but unless we listen to them, unless we ask them the questions, we're not going to be seeing it leading the way it is so possible to do.
But the expanse is so wide, from one laboratory to vaccine mastery to actually being one of those rarest countries where the vulnerable sections and the marginalized sections are catered to. And that's also very, very important aspect. Let me quickly go across to Eric. Thank you very much for joining us on DD Dialogue, Director and Representative UNESCO Delhi Cluster. Thanking Nishta Satyam also for joining us on the show. And Thank you so much, Dr. Yasmin Haq. Really, really nice to have you on the show. And with that, it's time to wrap up this edition of DD Dialogue. Remember, we started with the COVID containment strategy and response, India's combat strategy. Is India leading the way? Well, as far as the multilateral agencies like Unesco, UN Women and UNICEF is concerned, well, the answer is affirmative, because India happens to be one of those rarest countries where the marginalized and the most vulnerable are also taken care of. Although there is a long to-do list, but yes, you have this also happening at the domestic front, and you have vaccine Maitri also reaching out to the rest of the world, that part of the world that needs vaccine, and that part of the world is also looking up to India when it comes to combating COVID-19. Thank you very much. Namaskar.